What is primary health care? Anyone knows? Okay, before starting primary health care, we will discuss the types of health cares. Okay. So, do you know how many types of health care are there in our country? Any idea? How many health cares are there? Types of health cares? No idea. We have actually 3 types of health care: primary health care, secondary health care, and tertiary health care. Okay. Primary health care is the basic health care which is provided by the basic health centers where we are working as an ANM, LHV. Okay. And what is secondary health care? It is the health care where patients are admitted in the hospital for some serious illnesses, and services are provided by district hospitals or subdivisional hospitals. Those services are known as secondary health care. And tertiary health care, where specialist services are provided like neurology, orthopedics. So those health care and those services are provided by especially medical college hospitals and regional hospitals. Okay, super specialty hospitals. So those are known as tertiary health care. In this subject, we will discuss the primary health care because we are concerned with basically primary health care. Okay, as a ANM or the community health services. These are provided as primary health care. So primary health care is not a new care for the whole world. It is provided since long with the different names. Some says that it is basic health care, some says that it is essential health care, and some says it is primary health care. So to finalize this type of care, there was an international conference of health ministers in 1978. Okay, and in this conference it was decided that this type of basic or essential health care will be given a common name for the whole world, and that common name was primary health care. Okay, and this type of care, it should be provided like this, that every person, every single citizen of a country should get. Okay, be a poor or rich, everyone should get at least this type of service. So this type of service is finally finalized in this conference, and it was decided that its name will be primary health care. Okay, so all the different names of the whole world, they were changed to primary health care in 1978 after this conference. Okay. Now we come to the definition, how we define primary health care. So primary health care has some basic points, and depending upon these points, the definition was given. Okay. So what does this primary health care definition says? It says that the primary health care is defined as essential health care. It means everybody should get. It is needed. It is essential for everyone, and it should be based on practical, scientifically sound, and socially acceptable methods and technology. Okay, it should be based on scientific methods, but they should be practical. Means they should be usable for all. Okay, and they should be acceptable also by the all societies. Okay, so these will be primary health care, and they should be made universally accessible to all individuals. Okay, it should be like this, that everyone have the accessibility. Okay, that's why in some countries like India, we have started the sub-center to provide primary health care, so that every citizen of this country should get at least primary health care. Okay, and in the community through their full participation. One more point is given that the population or the community should have participation in those health services. Okay, how they will participate? It is we who can get the participation from the community. Okay, we can ask them during the planning phase, we can involve them during the health education phase. Okay, and through this we can take the participation from the country. Okay, from the communities. And one more thing, that it should not be so costly. Okay, it should be at a cost that the community and country can afford it and maintain it at every stage of their development. So it should not be so costly. That's why we are not making the huge building for the sub-center. We are keeping minimum staff and minimum technology or techniques or facilities so that we can maintain it. Okay. Otherwise, if we are keeping more staff, more sophisticated service, then we can not maintain it. Okay. Then finally, there should be the spirit of self-reliance and self-determination. Okay. It means it should be self-reliance. It can withstand with the help of the local community and the political willpower should also be there, that we can maintain it in the country. Okay. So this is the proper definition of primary health care. Okay. And to understand easily, we can say that whatever services we are providing through our basic centers like sub-centers, primary health centers and community health center in the rural areas, and some dispensaries or child welfare centers or MCS centers in the urban areas, we provide this type of service which is known as primary health care. Okay. In our syllabus for the community health, only primary health care service is studied or discussed. Okay. Secondary and tertiary we are not discussing it because we are not providing that. That service is provided basically by the GNM, BSc and other trained staff. Okay. Second point so first question from this chapter will arise, define primary health care. Okay. So you can define through the first slide. Second question will be, what are the elements or components of primary health care? Okay. So this question may arise in different ways, that explain about elements of primary health care, then the same answer. Explain about components of primary health care, then again same answer. And one more question can be asked, that what services are provided under primary health care, then again same answer will be there. So there are 8 points or 8 type of services which we provide in the primary health care, and these are also known as the components of primary health care. So what are those? First of all, number 1 is health education. Okay. Just by providing better health education, we can provide best primary health care, because we can prevent many diseases by just providing health education. If the people of community are aware for some spread of disease, they can prevent themselves. Okay. So health education concerning prevailing health problems and methods for preventing and controlling them, this is the first component. Okay. As you know, when we provide community health service, the most emphasis is given on providing health awareness or health education. Okay. Because it is the main component of our primary health care. Okay. Second point, promotion of food supply and proper nutrition. Okay. Because as we have discussed in last class, nutrition is a very important component of health. Okay. It affects our health. So if the community people are getting good nutrition, balanced diet, they can maintain or promote their health. Okay. So how we will provide? Why? Because we are not there to give the food to the community. We are health workers. But still, we can explain the methods of preparing the balanced diet, how we can mix the food items which are available locally, and we can motivate them, parents and even in school health services, that which is the good food and which is the bad food for health. Okay, so in this way we promote the better nutrition. Okay. Third component is the adequate supply of safe water and basic sanitation. Okay. In the rural areas where we cater through sub-centers, the main focus is on environmental sanitation or basic sanitation. Okay, because just by sanitation we can prevent many communicable diseases. Okay, so we focus on the environmental sanitation, sanitary latrines, promotion of sanitary latrines, and the potable water supply that should be safe. If the water supply is not safe, then any water which we are or community people are using, that should be safe, and we can explain them how we can make that water safe at home level by boiling, by adding some chlorine tablets. Okay, or if the water supply is through waterworks, then we can approach them that for the testing of the water and mixing of some chlorine or anything to make the water safe for drinking. And if in some areas, some rural areas especially, water supply is from wells, okay, then we have to make sure that wells are chlorinated for medication scheme. So this is our responsibility when we are providing primary health care. Okay. And then next is fourth component, which include maternal and child health service, including family planning. So these three basic services should be provided through all centers, being the important component of primary health care. What are those? Maternal services, which include antenatal service, postnatal service, vaccination for them. Then child health service, again it includes vaccination, breastfeeding for them, and preventing diarrhea, diarrheal disease, etc. for them. And third one is family planning services. So, hello. So, all the community people should avail all these three types of service from our health centers. Okay. Next component, immunization against major infectious disease. Okay. It is also a service which should be provided through our centers like as a primary health care. Immunization against all diseases for the women, for children, and if some services can be provided for adult also. Like during COVID epidemic, we provided COVID vaccination for all. Okay. So these type of services can be provided in primary health care. Then sixth point is prevention and control of local endemic diseases. Okay, whatever local diseases are there, fever, diarrhea, simple disease, we should be able to control them through our efforts. Okay. Seventh is appropriate treatment for common disease and injuries. So not only prevention, but if they occur like diarrhea, fever, any cut and wound, we should be able to treat them through our centers. Okay, that is also a component of primary health care. Okay, and finally, provision of essential drugs. So some basic important essential drugs should be available at the primary health care level, which include medicine for fever, iron and folic acid tablets, ORS. Okay, so these basic medicine should be available. So there are 8 services, basic services, which are included in the primary health care. Okay, so in this way we can complete our 2 questions from this chapter. Next question which can arise from this topic is principles of primary health care. So what are the basic principles on which the primary health services are provided? So there are only 4 components. If we are able to remember 4 names, we can give the answer for this question. Okay. So what are those principles? Number 1, equitable distribution. Number 2, community participation. Number 3, intersectoral coordination. And number 4, appropriate technology. Okay, so these 4 words we can remember and we can give our answer. Few lines we can write about them. For example, equitable distribution. What is the meaning? Just each and everybody who is staying there in our community should get equal share of the services which we are providing. Okay, without having any discrimination based on age, sex, class, caste, etc. Okay, so this is the one basic principle of primary health care. First principle of primary health care is the strategy of equity or equitable distribution of health services. Health services must be shared equally by all people, irrespective of their ability to pay. That's why primary health care mostly is given free of cost by the government. Okay, so that the equality should be there in all areas, rural or urban, and all must have access to the services. Okay. In the same way, second principle is community participation. Okay, so community participation is must. If we want to provide better primary health care, then we should take participation from the community. Okay, we should have the mobile numbers or link for the person who are influential in the community, like panch, sarpanch, school teachers, okay, Anganwadi workers, Asha workers, and we should mobilize them whenever we go for any camps, health camps, immunization camps, etc., so that they can mobilize the people for the activities. Okay, and when we are going to provide some health education through play, then we can also take participation from the community people. Okay, then if they participate themselves, then they will better understand what we want to tell them or explain them. Okay. The involvement of individual, family and community in promotion of their own health and welfare is the base of primary health care. Okay, because if we are from the community, they will listen us. If we are not from the community, they will treat us as a foreigners. Okay, they will not listen. So we should get participation from the community. Okay? And that's why, to fulfill this aspect or this principle, we have created Asha workers under the National Health Mission. Okay? Because Asha workers are from the community in which they are working. Okay? Next principle is intersectoral coordination. Okay, intersectoral coordination, again a very important principle, where we take the services or help from the other sectors other than health sector, like as we have discussed previously, education department, the school teachers, simple administration department like panchayat, waterworks department, because they can provide better facility for drinking water, agriculture department, animal husbandry department. Okay, in this way, for taking the participation from other sectors, we can provide very good primary health services. Okay, and finally, last principle is appropriate technology. Appropriate technology based upon the locally available resources. Okay, when we want to explain about better nutrition, we should know what are the local available food and what are the nutrients in them. Then we can explain. And the special services which can be provided through our sub-center and what are the services which can be provided through our higher centers like PHC. So these appropriate technology should be there. For example, if we want to provide a service for diarrhea, then appropriate technology for sub-center is availability of ORS. And the available services for diarrhea at PHC level is IV solutions. Okay, so these are the, and again we can say X-ray services which is needed, we cannot use at sub-center. Okay, because staff is very less and facilities are not there. So it is an appropriate technology for PHC only. Okay, so in this way for each center we should have appropriate technology for providing primary health care. So these are the 4 basic principles which we can write in our language. Okay, if we know the headings we can explain very easily. Okay. So these are, today we have discussed very important topic, primary health care, and which